Forensic Biology Screening Workshop, Case Processing. Case processing includes the following: location and collection of evidence, collection techniques, preservation of evidence, packaging and storage, documentation of chain of custody, and casework analysis. No evidence handling guide can address every conceivable scenario, nor is this intended to supersede policies and procedures that a laboratory may already have established, but to serve as a general overview of evidence collection and handling. It is designed to supplement instruction provided by your local forensic laboratory. Physical evidence is any tangible object that can connect an offender to a crime scene, an offender to a victim, or a victim to a crime scene. Biological evidence is physical evidence, but it is not always visible to the naked eye. Sources of biological evidence: blood, semen, saliva, urine, feces, hair, teeth and bone, tissue, and cells. Many body fluids fluoresce under alternate light sources. Lighted magnifiers may assist in locating stains. Microscopic evaluation can aid in locating small stains. Mapping and/or general swabbing techniques can aid in locating body fluid stains. Proper sample handling can avoid contamination. Disposable gloves that are powder-free should be used. Powder can fluoresce and inhibit PCR. Gloves will protect from perspiration from the collector's hands getting onto the evidence. And you should change gloves each time a new piece of evidence is handled. One option is to wear double gloves and change the top pair often, between each item of evidence and after touching your face or nose. Masks protect the evidence from excessive talking, sneezing, or coughing. Also, eye protection, shoe covers, and gowns can also be used. Actions to avoid when handling evidence: touching any areas or items where DNA may exist, touching your face, nose, hair, and mouth when collecting and packaging evidence, sneezing, coughing, and excessive talking near the evidence. Gloves and/or masks should be changed if contaminated. Proper evidence collection is aimed at avoiding contamination, ensuring safety and health of personnel, and the preservation of the evidence. Protecting the evidence helps to prevent contamination. It preserves the evidence with proper packaging, also ensures proper storage, and that you use appropriate labels, example biohazard labels, on the evidence. When working with evidence, you should clean utensils appropriately, use disposables when you can, package samples separately, air dry samples prior to packaging, keep reference samples separate from question samples, use distilled water, and aliquot the water out if possible. Things to avoid when handling evidence: you should not allow contact between drying items, do not expose items to heat or humidity, do not contaminate your water or use too much water, do not use staples, and do not package in plastic unless the items are dry. It is better to use paper bags or envelopes if not fully dry to prevent mold and bacterial growth. For the collection of biological evidence, use disposable tools if possible: scalpels, tweezers, scissors, and spatulas. Clean non-disposable tools prior to the collection of each item. If disposable instruments are not used, then clean the instruments with 10% bleach solution and rinse with sterile water or alcohol and thoroughly dry. Cleaning should be done prior to use on each sample. When collecting sharp objects, for safety reasons, package the evidence, such as knives, in small cardboard boxes or other rigid containers. Package the items to limit their movement within the container. Never collect evidence without documenting the location and the conditions first. Sketches, photographs, and detailed notes are helpful in this process. Here are some common collection techniques. For cuttings, remove with a sterile or clean cutting device. For wet absorption, a sterile swab, gauze, or threads lightly moistened with deionized water could be used. This concentrates the stain in a localized area. It should be allowed to air dry, and you may follow with a dry swab to ensure thorough collection. For scraping, use a clean utensil or razor. Scrape onto a clean paper, fold, and package. Package each stain or swab separately. Do not combine stains. Label multiple swabs from the same stain accordingly. When handling hard, smooth surfaces, for example on immobile objects like car doors, window ledges, and tile floors, you collect onto a sterile cotton swab, or you can scrape onto paper using a sterile scalpel. You should also collect to control and package separately. For soft, porous surfaces like wood, carpeting, and upholstery, cut the stain from the object, collect to control, and package separately. For proper seals, use tamper-resistant tape. Do not seal evidence with the following: staples because of the risk of injury and sample contamination when handling or in packaging, glue, paper clips, or scotch tape. The seal should be marked with your initials or another appropriate identifier. The fewer people who handle evidence, the better. Decreases the chance of contamination, and it also assists in court admissibility hearings. Many laboratory systems store dried biological evidence at room temperature. Items which have body fluids on hard, smooth surfaces such as metal or glass should be stored at room temperature. This type of substrate tends to sweat when taken out of the refrigerator or freezer, which could cause the body fluid to sweat off onto the packaging. The degradation of body fluids is retarded when stored frozen. However, studies have shown that under appropriate conditions, room temperature is okay. Chain of custody is a record of individuals who have had physical possession of the evidence. Chain of custody is critical in maintaining the integrity of the evidence. If DNA analysis results in a foreign DNA type, it may be necessary to identify persons who handled the evidence. Components of chain of custody are identifiers that describe the evidence at the time it was found, location, position, and date and time of collection, and packaging and sealing information. Evidence documentation. Examine package seals for tampering. Mark evidence according to your lab policy. This may include case number, exhibit number, date, and initials. Note the conditions of the seals. For example, one seal brown paper bag can be written as SBPG. Open evidence with a scissors or knife. Try not to cut through the existing seals if possible. If this is not possible, it is advisable to document this in the case file. Document the package contents. If there are multiple layers of packaging, all should be documented and marked appropriately. When possible, mark the evidence with the appropriate identifier. Analyst notes should be sufficient so that the item of evidence can be identified at a later time, in interviews or testimony. The description should contain sufficient detail. A shirt may be described as follows: red button-up long-sleeve shirt, with a tear on the front right arm wearing, several stained areas visible on the front left side wearing, and one button missing from the front pocket. Digital images will assist in item descriptions. They also save time and enhance the case file. Prior to evidence screening, you should remove hairs and debris to a debris fold. This is possible evidence for later analysis, and it should be documented in your notes. When looking for blood, first perform a visual exam. You may use a flashlight, illuminated magnifier, or microscope. Mark stained areas. Blood appears different on different substrate. It is not always red. Environmental factors can play a role. Degraded or old blood may look different. For blood, test mark stains as appropriate and indicate the results on the items and notes. You may choose to take a digital image and mark those areas tested on the image. If all mark stains result in negative results, the analyst may use mapping or general swabbing technique. Section of the item, take general swabbings from each section and test all general swabbings. If any stain is positive, then document and remove that portion of the stain for DNA testing. This should also be denoted on the picture or the diagram. For dried small blood spatters, collect with a cotton swab. Also collect to control and package separately. Packaging of trace evidence. Package in paper, do not use plastic. Evidence can stick to the plastic packaging from static. Also, collect so that you minimize loss or contamination. Some examples of trace evidence are hairs, loose fibers, paint chips, soil, and gunshot residue. When packaging evidence, label each item with a unique identifier: department record number, unique item number, collector's initials, date and time, and description. Place the evidence into new paper bags, not plastic bags, to prevent degradation. Sexual assault kits. The common items found in sexual assault kits are vaginal swabs, cervical swabs, anal swabs, oral swabs, smears, and fingernail scrapings. When screening for semen, the alternate light source or ALS is a good screening tool. Semen is visualized using 400 to 500 nanometer wavelengths with orange safety goggles. It is performed in a dark room. Areas of fluorescence should be marked. Semen fluoresces due to Pseudomonas fluorescens, which is bacteria containing fluorophores, and flavins. Fluorophores are excited by the energy source, which is light, and they emit light energy and become visible. For sexual assault kits, it is optional to do the ALS exam. You should screen swabs with the acid phosphatase test, and then do a microscopic exam on the swabs. Even if the swabs are negative with the AP test, it is possible that there is breakdown of the proteins by the body and the sperm may survive. With oral swabs, oral assaults are not always reported, and oral swabs should not be treated as a standard until tested for semen. If the acid phosphatase test is positive and microscopic exam is negative, then you should perform the prostate-specific antigen P30 test. Causes of acid phosphatase positive and microscopic exam negative are vasectomized male, a low sperm count, aspermic, no sex occurred, or false negative on the acid phosphatase test. Causes of acid phosphatase negative and microscopic exam positive is the breakdown of acid phosphatase, which is water soluble, and it can also be due to environmental factors such as heat, humidity, and bacteria. Also, acid phosphatase breaks down over time. For juvenile sexual assaults, assailants may use saliva as a lubricant on juveniles, so you may want to perform amylase tests on swabs, but not the oral swabs. Some labs send the samples to DNA without an amylase test. When examining for semen on evidence that is not swabs, perform a visual exam and mark visual stains. Then perform an exam with ALS, the alternate light source. After viewing with the ALS, take representative cuttings from marked areas that are visible and also those that gave fluorescent stains. Test with acid phosphatase plus microscopic examination or prostate-specific antigen P30. With panties, you may want to perform a microscopic exam even if acid phosphatase was negative. Depending on the case scenario, you can perform microscopic exam on acid phosphatase negative samples. The body breaks down water-soluble proteins over time. A semen stain on cloth is like a snapshot in time, unless environmental factors like humidity affect it. Document and remove positive areas for DNA testing. This flowchart shows the way testing should proceed when examining items for the presence of semen. With sexual assault cases, it is important to know previous sexual encounters with consensual partners. Sometimes you need to request elimination standards from consensual partners, and this is used to determine if the evidence came from the victim, the suspect, or someone else. When looking for saliva evidence, these are the main items of interest. You can have masks from robberies, bite marks, or stamps and envelopes. The most common cases involving testing for saliva are burglaries, juvenile sexual assaults, and assaults with bite marks. You should mark any visual stains, then screen with the ALS and mark any areas of fluorescence. Then take representative cuttings or swabbings to extract for amylase, test of choice. Positive areas should be documented and removed for DNA testing. Many items need to go through other sections of the lab. Common requests are latent prints, trace and microanalysis, or firearms. For latent prints, it is important to talk to the detective to find out what they are looking for. If you need both serology and latent prints, you should do serology first if possible. You can have the latent examiner present if you are worried about destroying prints, if they are available. For trace or microanalysis, talk to the detective to find out what they are looking for on the evidence. If microanalysis is necessary, the evidence should be swept first before you open for testing. This prevents the transfer from you to the evidence, like hairs or fibers, or the loss of trace evidence. With firearms, serology tests don't typically interfere with the firearms analysis. Once again, talk to the detective. You should have evidence first to prevent contamination if possible. If firearms examiners handle before you, they should wear gloves. Serial number restoration uses chemicals which may affect stains. Sometimes cases need touch evidence on guns or bullets. It is important that the evidence is protected. Swab first for DNA before handled by any other sections if possible. You should also be aware of the storage policies for other sections. For example, don't store blood on glass or guns in a freezer. And also, it is important to know the limitations and functions of other sections. Talk with detectives. Sometimes they have to pick between latent print analysis or serology. Reference samples can be blood from blood transfusions, buccal swabs and saliva, clothing as a last resort for secondary standard. A toothbrush, hairbrush, or glasses can also be used as secondary standards. Other standards in the case could be from all persons who had access to a crime scene. They should all be documented, because it may be necessary to collect samples from these individuals in the future. With a burglary, all persons who had access to a crime scene should be documented. It may be necessary to collect samples from these individuals. For hair evidence, the types of testing available are comparative, physical and chemical characteristics, and whether it is of human origin or not. And for DNA testing, there is nuclear DNA, STR DNA analysis with a root only, and mitochondrial DNA if there is no root. Touch evidence is epithelial cells that have been transferred from the person to the evidence via touching. These samples tend to have low amounts of DNA, and you would expect body fluid stains to have more DNA than touch evidence. Here are some body fluid comparisons. An undiluted semen stain with sperm will have more DNA than a blood stain. Both blood and semen have more DNA than a saliva stain, and body fluids in general have more DNA than wear area stains from armpits or collars of a shirt.